Odds ratio versus relative risk. Relative risk and odds ratio are both statistical measures used to compare the strength of an association between an exposure and an outcome, but they measure different things. Relative risk compares probabilities, while odds ratio compares odds. Relative risk measures the probability of an event happening, while odds ratio measures the ratio of the event happening versus not happening. To choose between them, look at your study design. Use relative risk for prospective studies, like cohort studies, clinical trials. Odds ratio for retrospective studies, like case control studies. Let's have a conceptual breakdown. The fundamental difference lies in the denominator used for calculations. Relative risk compares the absolute risk, probability, between two groups. It answers: how much more likely is the exposed group to get the disease, compared to the unexposed group? On the other hand, odds ratio compares the odds of an event between two groups. It answers: what are the odds of the disease occurring in the exposed group, versus the odds in the unexposed group? Let's apply these concepts on a standard 2x2 contingency table. Most epidemiological calculations start with this standard framework. That shows outcome of a disease in the exposed and unexposed groups. Let's apply mathematical formulas on these tables. Calculating relative risk. Relative risk is the ratio of the risk in the exposed group to the risk in the unexposed group. For this, we will first calculate the risk in exposed group, and then the risk in unexposed group. Then we will apply the formula of relative risk. Now, we will calculate the odds ratio. Odds ratio is the ratio of the odds of the disease in the exposed group to the odds in the unexposed group. How to interpret the numbers? Regardless of whether you are looking at relative risk or odds ratio, the interpretation follows a similar rule of thumb. If value is equal to 1, then there is no difference in risks or odds between groups. That means that exposure has no effect. If the value is greater than 1, then the exposure increases the risk or odds of the outcome. If the value is less than 1, then the exposure decreases the risk or odds of the outcome. That means the exposure has a protective effect. When to use each of these two? Use relative risk when you know the total number of people at risk. For example, in cohort studies, and you want to give a simple, intuitive answer to a patient or the public about how an exposure affects their chances. Use odds ratio when you are working backward, for example, in case control studies or running complex statistical tests like logistic regression.